You want to fix your breathing, but at what cost? I'm Dr. Angela Sturm. I'm a facial plastic surgeon, and I do a lot of rhinoplasties and a lot of functional nasal surgery. And one of the main things people come in for is nasal obstruction or difficulty breathing through their nose. And this affects more than what you realize. It affects your sleep. If you can breathe better, you can sleep better. You can breathe more efficiently while you're sleeping. Some people, it reduces their snoring. Snoring is one of those things that has a bunch of different contributors, but if you're breathing more efficiently through your nose, it can make that better. Exercise is easier because you're able to breathe the way that you're supposed to breathe through your nose. And just in general, you can have more energy. You can smell things better. Things taste a little bit better because you're getting more air to the nerves that can perceive that. There's a lot of benefit of being able to breathe through your nose better. But pros and cons with everything. If you're thinking about this, what are all the things you should be thinking about? With any surgery, there come risks. With any surgery, that's pain, bleeding, infection, scarring, need for more procedures. So when you're thinking about septal surgery or septoplasty, the pain is minimal. Most people don't even need pain medication, but that is something, it's more discomfort, it's more stuffiness, it's more just that it's a bother. If you're doing this with rhinoplasty, it can feel more like a sinus headache or sinus pressure, more from where we're sculpting the bones. But if you're only doing this for breathing and you're doing a septoplasty, and even if you include a turbinate reduction, most people feel just kind of stuffy, like a cold, for about a week or so. And it gets better and better. Around 3 months is where 90% of the swelling has gone down, and it gets better up to a year. Bleeding, pretty minimal risk for this. The times that this can happen are during surgery, where we can control that. 24 hours, I like to keep all my patients very close for the 24 hours after surgery, just in case you're here, so we can take care of you. And then the next time point would be between 7 and 10 days. Whereas if you have, it's just like you get a cut on your skin, you have a little scab, that scab may fall off and cause a little bit of bleeding. At that point, there's things that we can do most of the time in the office just to stop that and help you go along your way. But the risk of that is very small. That's less than 5% risk that would happen. Scarring, also very small. If you've had a lot of trauma to your nose, that would be one reason why I would bring this up to you more of the tissues can be more inflamed and can be at more risk to have scarring inside the nose. It's something that we would have to address later. If you already do have scarring from trauma, that would be something that we would separate those scar bands, and I can put in little plastic sheeting to help things heal separately without it healing together and causing more nasal obstruction. Need for more procedures. With the septoplasty, the risk that is low, but you do want to make sure you go to someone that does these all the time, is if it is a very severe septal deviation, there is a risk of a septal perforation, which what that means is the septum divides the sides between right and left. If you have a hole that goes in between the two, then that's a septal perforation. If it is small, a lot of times it doesn't cause a lot of trouble. But if it becomes a little bit bigger, you can have whistling, crusting, some difficulty breathing through your nose. And then if it becomes very large, you tend not to have symptoms anymore, kind of ironically, because the air is just communicating freely between the two sides. This is something that can be prevented with good surgical techniques, being very aware of the tissue, the way that you're handling the tissue, and going to someone that knows how to repair a septal perforation. So if anything very rarely does seem to happen, they are able to repair it at the time and you're not having to deal with something after the surgery. So extremely rare that would happen, less than 1%, I believe, but things that can happen. A lot of times with septal deviation, fixing a septal deviation, we will also reduce your turbinates. So your turbinates are structures that heat and humidify the air. But if you have a very deviated septum and you have one on either side, you straighten the septum, the side that wasn't a problem can become a problem. So I like to evaluate the whole airway as one and say, okay, I see that could be an issue, and we're going to go ahead and do your turbinates at the same time. It does not add much to the surgery as far as downtime or discomfort. It's all kind of about the same and can get you more space in there to breathe. Other things to think about is exactly exactly why you're doing it and what you're going to get out of it. With a septoplasty, the surgeon can get you more air flow through the nose. And so if you're just stuffy, one side's always hard to breathe out of, this is a perfect way to address that as long as there's a physical septal deviation. But if you're having more symptoms of like coughing, sneezing, runny nose, itchy, watery eyes, and some seasons it's worse than others, it's kind of on both sides, you may still have those symptoms because those are more related to allergies. So that's something good to talk to your surgeon about beforehand so you have an idea of what it can address and what it's not necessarily going to address. So you're addressing what you want and what is really bothersome to you. There's pros and cons of every surgery. I've had a septoplasty myself, and I will say that it is life-changing. I breathe so much better. Listening or reading about other people's stories of what they have is helpful for you so you can see, exactly what that can do for you. Let me know if you have questions about nasal surgery or septoplasty, and you can find me at www.drangela.sturm.com.